Melanie Jay is a professor of medicine and population health at the NYU Grossman School of Medicine. She's also the director of the NYU Langone Comprehensive Program on Obesity Research. Melanie, thank you so much for taking the time today.
Thank you for having me.
So, to start, I'd love to just talk about why it is important for us as a society to research and address obesity and also get a sense for what the scale of the problem is right now. Can you talk about that?
Sure. Well, I think the scale of the problem is one of the reasons why we really need to address it. When I started doing obesity research back in the early 2000s, the rate of obesity was 32% and had doubled in 20 years, and now it's 42%. And it's still kind of rising. Maybe we reached a plateau. I'm not sure. Certainly with the higher levels of obesity, like the class 3 obesity, where you really start to have very significant health problems, that is definitely still going up. And it is one of the factors that's going to make it so that the future generations are actually less healthy than the previous generations. Also, obesity affects almost every part of our bodies, and it affects physical health, it affects mental health. And it leads to other chronic diseases. So if we can address obesity, we can potentially prevent a whole host of other chronic diseases.
Well, that leads me to my next question, which is how does, you're talking about those effects, how does obesity cause things like diabetes, heart disease, and kidney disease?
Yeah. Well, one of the hallmarks of obesity is excess adipose tissue or fat. And we used to think that fat just kind of sat there and stored energy, but is actually very metabolically active. And for instance, with diabetes, one of the things that the adipose tissue does is makes people what they call insulin resistant. So we know that with diabetes, your blood sugar is too high. Insulin is something that when we eat, it brings down our blood sugar to a normal level. And the pancreas makes insulin. And when we have obesity, when people have obesity, they tend to be more insulin resistant, which means the insulin doesn't work as well, which means you need more insulin to bring down the blood sugar to a normal level. Because when the blood sugar is high, that causes a lot of damage to your organs, to your blood vessels, and that's what can lead to kidney disease and heart disease and all sorts of things that people get when they have diabetes. So that's one way, is through insulin resistance, and that will lead to diabetes. And so that's why your doctors check your hemoglobin A1C, for instance, that shows how your average of your glucose is over time. And in people with obesity, it tends to start going up to the pre-diabetic range and then to the diabetic range. And then, so with heart disease, also, you have inflammation. So the adipose tissue causes more inflammation, and the inflammation can also lead to heart disease and other chronic diseases. So those are kind of the main ways, is through insulin resistance and inflammation. And then there's a whole host of other effects that we have from this very metabolically active adipose tissue.
Yeah. So I also want to talk to you about some of the barriers to health. So how do food insecurity, chronic stress, and systemic inequities create barriers to health?
Yeah. Well, absolutely. Well, let's just go back to the causes of obesity. Let's do that. So obesity is as heritable as height. It's genetic. But not everybody who has a genetic predisposition gets obesity. And obviously, our genes did not change over the 20-year period that I just mentioned to make obesity go up. But genes interact with environment. So you have environmental factors, and those things together lead to weight gain, obesity. So not everybody, if you don't have the genes for obesity, a lot of people, you have the people who can eat whatever they want and never gain weight. But most of us have some of the genes for obesity. And so when it interacts with our environment, it can lead to weight gain. So with the environmental factors that you're talking about, like food insecurity, which is that you're living in a place where you can't find enough healthy food, or that's a food desert. Food insecurity is when you don't have the money to buy food regularly. And so what happens with that is that it makes sense then, when you have money to buy food, that you want to buy the food that can sustain you the most, and that's the cheapest. And a lot of times that's the fast food And they go hand in hand, living in a food desert and having food insecurity. And so, and then of course, chronic stress, if you have financial stress, that's going to cause chronic stress, but also living in a difficult environment, whether, no matter whether it's poor or rich environments, you can have a lot of chronic stress, and chronic stress can not only make it difficult to buy food and have the time, but it raises your cortisol levels, and cortisol can lead to more weight gain as well. And then you talked about systemic inequities. Those create a lot of barriers to health, about who can access healthcare, who can get treatment for obesity, who can get healthy food. And then there's systemic inequities even in terms of outcomes. So all those things are major barriers to both obesity treatment. They affect who develops obesity. So yes, those kind of health disparities and health inequities are a big problem.
Yeah. So what are some of the innovative strategies that you have been researching to improve obesity care?
So we are really interested in how do we support people engaging in weight management. It is really hard to lose weight when someone develops obesity, especially because when someone develops obesity, they their body wants to hold on to that weight. You almost have like a new weight set point. And so when you start to try to lose weight, what happens is that your hunger hormones go up to make you more hungry, and your metabolic rate, or your ability to burn calories, goes down. So you burn less calories. And that keeps, what happens is people will lose weight and then they'll kind of gain it right back, because evolutionarily we were developed so that we could sustain famine. And when we start to lose weight, our bodies don't like that
Hmm.
in general. Some people can lose weight with little support, but what I'm really interested in is how do we support people, especially in healthcare settings, whether we're talking about lifestyle or whether we're talking about medications or bariatric surgery. My studies have been focused mostly at this point on lifestyle change. And we know that the most effective and evidence-based programs are things like the Diabetes Prevention Program or the MOVE program, which is at the Veterans Affairs, which involves up, 16 or more sessions in a 6-month period to really support people to engage in this lifestyle change. And it's hard though to get people to do that. And so I'm really interested in how do we support people to even engage in these difficult strategies. And so we've used peer coaches and health coaches. We find that peer coaches that were, when we did this in the veteran affairs, and when we had the veterans as peer coaches, it worked better. Um, I'm really interested now in when people are on the medications for weight loss. Some of the new obesity care medications that we call GLP-1 receptor agonists, and how do we better support people on those medications? Because it seems that people are going on them and then going off of them really quickly. And part of that is due to cost, but a part of it's due to a lot of other things. Because it's hard to stay on the medications. People go seem to it seems that up to like anywhere between 50 to 75% of people go off of them at 1 year. And and a lot of that has to do with cost, but some of it has to do with side effects, some of it has to do with people's beliefs that obesity is not a chronic disease, and that if they lose weight, then they can go off of it. And so I want to have more support and try to figure out how do we best support people, no matter what path they're taking on their weight management journey.
Yeah, with regard to the medications, how are these new medications that are targeting obesity changing the way doctors and patients and maybe also society thinking about and addressing obesity?
Yeah, I mean that's a big question, right? That's a whole that we could spend an hour just talking about that. But I think that I think there's some really positive aspects to it, and then there's some negative aspects to how people are thinking about obesity. I think positively, it's showing people who have lost hundreds of pounds in their lifetime through lifestyle and only to gain it back, who had tremendous willpower, who could not keep their weight off, but when they started these medications and stayed on them, they have been able to do it. And I think what is really showing people that obesity is not about willpower. Obesity is a disease, and that these medications help go against that increased drive for hunger and lower metabolic rate that happens when people try to lose weight with lifestyle. That doesn't happen as much with the medications. The medications almost lower the set point that your body's willing to be at. And so I think that doctors and healthcare professionals and other people are really starting to realize that these medications are targeting some of the root causes that keep people having obesity once they develop it. And so in that sense, it's very good. Um, it's in some ways it hasn't changed. I mean, before we had the medications, a lot of people would just be told by their doctor, "Oh, you just go home and eat less and move more and lose weight and come back, and then we can talk more about your back pain or your knee and hip pain because." And that wasn't helpful, right? It wasn't supporting people. It was just a prescription to go home and do diet and exercise. I think now with the medications, some people are going to the doctor and or a lot of times even like some wellness clinic, and they're saying, okay, here's a prescription and go home and take this prescription. No, yes, you probably should eat better and exercise too. And then people don't stay on the medicine. Or they're not exercising, eating enough protein and doing the resistance training and eating enough fruits and vegetables and fiber to really make it to make a difference. So in some ways, that's why I'm very interested in how do we best change our system to better support people, because it's not easy to have a chronic disease. It's not easy to keep. And the other thing that hasn't that changed is that unlike other chronic diseases, people don't believe that they should be on treatment the rest of their life,
Mm.
right? When someone gets hypertension, you put them on blood pressure medicine, and it puts their blood pressure down. They're not surprised if they go off the blood pressure medicine, their blood pressure goes back up, right? And the
Mm.
same thing is true with obesity, right? If you take a medicine that changes some of the brain pathways and how the brain communicates to the gut and the signaling, and people lose weight and they take it away, a lot of times people gain weight right back.
Mm.
And so we really need to support people that this is something. Once you develop obesity, it's a chronic disease, and you have to manage it lifelong. We don't have a cure yet.
Yeah.
Someday we might, but we don't yet. We don't yet have the cure. This is kind of something that we manage lifelong.
So what is the impact of the obesity stigma on patients and this conversation generally?
Yeah. Well, I was also going to talk about some of the bad things with the medication. So some of the bad things is that it just creates new forms of obesity stigma. So obesity stigma is that people tend to blame people who have obesity for their disease, or somehow have biases against people who have obesity. And people with obesity say that they feel discriminated against even in healthcare settings. Like up to 60% of people with obesity say that they've experienced stigma in healthcare, and that might lead people to avoid going to the doctor. With the medications, you have a new form of obesity stigma. You have the stigma of, oh, well, you should just be eating better and exercising. You should not be taking a medication. You should not be treating this. You should be able doing it the natural way. The natural way is better. And what they don't realize is that then you're kind of double stigmatizing. It's like you have obesity and now you have a treatment for it, and for a lot of people it is effective, and then they get kind of shamed for the way that they were able to manage their obesity. So I think we really need to stop blaming and shaming people both for having obesity, because again, obesity is caused by interaction of genes and environment, right? Um, Personal choices are super important when you're trying to lose weight. You have to like make all sorts of personal choices. But a lot of times personal choices play a very small role. It's the environment that you live in and how that's interacting with your genes, because your environment is what drives your choices in the first place.
Yeah. Well, so what is the future of obesity research look like?
Well, I think there are going to be a whole lot of new treatments. we're understanding obesity much better and new pathways. And so I think there's going to be a lot of new treatments coming down the pike. I'm not involved in making these new treatments. But what I do think is that we need to figure out how to best use these new treatments and support people on these new treatments and improve the healthcare system to improve access to these new treatments, so that we have more equitable care. Because right now, only affluent people can afford to buy them, or people who have good, really good insurance. And we want to make sure that we can offer, figure out how do we offer care to everybody with, without bankrupting the system, obviously. And how do we best support people so they're not going on, off, right? That they're able to really stick with it and manage their obesity and improve their health. So I think that those are kind of the two different ways that where research is coming. And there's so much we don't know, even just in terms of we have these medications, but we don't know uh, how to best what diets, for instance, would be the best, with the medications. We don't know how much support is needed for people on the medications. We don't know if you get to a weight, like to the weight that you want to maintain, do you need to be on the full dose, or can you cut down, or are there other things that you can do to continue to manage your weight? So there's so many new areas to explore and discover. And
Yeah.
so I think that that all these kind of this revolution almost in obesity care over the past decade, I think leads to more research questions.
Yeah. Awesome. Well, Melanie, thank you so much for taking the time to share your research and your insights. And I hope we can continue the conversation down the road.
Great. Yes, thank you.